The people that are the poorest, the people that are the most vulnerable are also experiencing the highest levels of air pollution. The vast majority of the world's population, well over 90%, is exposed to levels of air pollution that are higher than, what we know is safe or what is okay for health. At a global scale, yes, everyone is exposed, but the places that have the highest exposures, the most extreme exposures, tend to be in some of the poorest places in the world. Those are also the places where there's the fewest air pollution monitors that are in place. The vast majority of health impacts are also experienced in low and middle income countries. Places that have the highest levels of air pollution in Dhaka City are also the places that are the poorest. On this global scale, where you have the global poor that are experiencing the highest levels of air pollution, but even when you bring that down to the sort of municipal or city scale, it's the same thing.
It has really significant social implications, and then there are many communities within the region that are particularly impacted. Groups like street vendors, traffic, police workers who are often outdoors for many long hours, people that work in the waste sector that might get disproportionately exposed to higher levels of air pollution on a very consistent basis, resulting in diseases, which would then mean loss of livelihood and overall impacting the well-being and quality of life for people. But also, if someone in your family has the disease, they're going to require someone to take care of them. So people may not be able to go to work, children may not be able to go to school, someone may lose their livelihood because they have to take care of a family members.
Another sort of aspect of that is thinking about rural versus urban population. So a lot of my work has been focused on household air pollution. So the air pollution that's emitted from cooking and heating with biomass and coal stoves. And again, by far the most of that exposure and the health impacts of those exposures occur in the rural poor. So people that are using these stoves and fuels because either they can't afford an alternative or a cleaner alternative, or there's not the infrastructure in place to support that. So maybe they don't have the ability to get LPG or the ability to get sufficient electricity that's going to power all of the devices that they would need to power for their cooking and heating needs. So we see this sort of over and over again, where people that are the poorest, people that are the most vulnerable, are also grappling with much higher exposure to air pollution and the health impacts that come from that. And as we move into lots and lots of places around the world where, again, the poorest communities are in places that are near emissions, right? So people that are working in jobs in industry, for populations that are in places closer to air pollution emissions, they absolutely experience much higher levels of pollution. We've seen this, over history in, throughout North America, throughout Europe.
Like in UK, we have got people working in construction industry, welding industries without using any personal protective equipment. So they are inhaling a lot of airborne pollutants, which might be, for example, if they are working in the brick kiln industry, they are inhaling a lot of silica dust, and there is a lot of respiratory health problems in those who work in the brick kiln factory as well. But we don't have that information. There is not much data done here.
There are different social groups or different parts of the society that are differently affected by air pollution. So it can be a gender, it can be the profession the people are involved in. So depending on it can be economic status, or it can be the geographical region where they are living.
Here come also economic inequality. Those who have less money usually have less choices in their living environment. One of the examples is use of fuels for cooking and heating. We still have big problem in the world globally, but also in this region, with use of solid fuels for cooking and heating. And that is actually as big a problem from the health point of view as ambient air pollution. And at the same time, this heating and burning of solid fuels for heating and cooking is affecting ambient air. So, of course, persons directly exposed to emissions from heating and cooking with solid fuels, their exposure is several times larger than their neighbors who don't use this. So economic factor is very strong here because unfortunately in many situations it's more expensive, higher if you want to switch to cleaner fuel. In most cases this cost is borne by less affluent parts of population and is deepening inequality in health.